Good morning, everyone. It is 9 a.m. on Thursday, February 29th. Happy Leap Day. Feeling very hopeful that today will be less frenetic than yesterday. So we're going to spend the next 2 hours talking about the Education Fund. I asked representatives from the School Boards Association and the NEA and the Superintendents Association, essentially what they think we should think about as we proceed with our work. Key values they think we should hold, solutions that they might want to offer, but guardrails that might be important for us to keep in mind, and to share those with us today on behalf of their members. As we're listening to the testimony, I'll be thinking about sort of some of the ways that we've been framing the conversation so far. So there's what can we do for fiscal year 25? And there's what can we do for fiscal years, 26 and beyond, right? So those sort of three separate things, right? So the things we can do from fiscal year 25 are more constrained. Anything that we're going to do for fiscal year 26, we actually have to pass this year, right? And then thoughts for fiscal year 27 and beyond. And then there are the different levers that we have available, right? There's strategies for cost containment, making sort of the education system more efficient and effective. Some of those are our purview and our sort of fiscal levers. Some of those are the education committee's purview and are about sort of long-term strengthening of certain sort of statewide systems. And then what are things we can do in the revenue world to make that more efficient and effective as well, to make sure we're adequately funding education in an equitable way. And so again, short-term, long-term, medium-term, and then sort of those levers available to us. Right now, we have, this like three-legged stool that is often out of balance, right? We have the equity that's really essential to our system. We have the local control that's central to our system. And then we have this challenge around simplicity and complexity that people are making decisions in. So that's sort of the frame that I'm going to be using as I listen to what they are hoping we will be keeping in mind as we move forward. We usually pass a yield bill. That is a very, very simple bill. It's a very short bill usually. Probably it'll be a more complex bill this year. And that usually happens as one of the last bills on Money Crossover Week. So with that, Sue and Chelsea, I understand that you two are joining us together. Please join us. Thank you.
Thank you.
And you all, we have, this is almost a 2 hour block of time we have. So I want to make sure that they really share with us what they want to share, but I also want to make sure there's extensive time for us to ask questions as well.
Great.
Good morning. I'm Sue Siglowski from the Vermont School Boards Association, and with me is Chelsea Myers. She's the Associate Executive Director for the Vermont Superintendents Association. I think this might be the first time Chelsea testified in front of your committee.
It is. Chelsea, welcome. We're really glad to have you here today.
So Jeff is not with us today, so I'll have to do.
I think you'll do well. Thank you.
So we decided to do some joint testimony to you today, and we've been asked to cover 4 areas. You just summarized them, and we hope we're able to provide you with some good information on all of them. The first that we're going to cover is how to set the yield this year, and then long-term reforms starting in fiscal year 26 that would need to be passed this year. Third, long-term reforms in spending and taxation that could be passed next year. And fourth, changes to education spending to make it more efficient and effective. We consider the topics of today's testimony to be critically important to the future of public education in Vermont. And both of our associations are committed to working with you on these issues. And we decided to offer joint testimony today because a lot of our recommendations were overlapping, and we thought we would save you some time. We did testify separately last week in House Education, and that testimony is available. I think maybe some of you have reviewed that testimony, so you'll be hearing some of the same things that you heard there. We discussed the most significant education cost drivers and had some recommendations that we had identified. And those recommendations were developed in a collaboration with the Vermont Principals Association and the Vermont Association of School Business Officials, excuse me. We didn't include inflation because that seems to be something that's not within the control of any one committee in the Vermont legislature. So we'll move on to starting by providing our thoughts on setting the yield this year, including any actions you could take that would immediately affect fiscal year 25. In previous testimony to this committee, the presidents of both of our associations asked you to do all that you could to set the yield as high as possible. And they acknowledged that this would necessitate finding additional non-property tax revenues for FY25. And their testimony, we think, made a compelling case for doing that. And so we appreciate your work earlier this week when you were looking at the cloud tax as a possible source of new revenue for the education fund. And we're offering these additional ideas, which we provided in a written testimony that I believe is posted on your webpage now. The first has to do with universal meals. When the legislature made that program permanent in Act 64 of 2023, our associations advocated for funding the program through the general fund. And we continue to believe that that should be the source for this type of expense. The cost of the program is estimated to be $26.5 million. And if it is to remain part of the education fund, we'd ask you to consider creating a dedicated source of funds that is not the property tax to support that program. And just some examples of ideas to think about would be the meals and rooms tax or taxes on sugary beverages or candy. Currently, that program is contributing to a lower yield in the education fund and higher property taxes. Along the same lines, the legislature created a PCB program for schools using the education fund to start that program without a plan for funding the program. Whether the completion of that program comes off the top of the education fund or is left to individual school district budgets is going to be a significant burden for taxpayers. So we recommend pausing the PCB testing program until such time as it can be fully wrapped into the school construction aid program. PCB remediation and other environmental program requirements should be integrated with the capital investment in school facilities in order to use taxpayer dollars efficiently and wisely. Even with an immediate halt to the program, school districts that have already been tested in the program should not be responsible for any additional testing or remediation costs in accordance with Act 78 of 2023. In addition, the funding must not be derived through the property tax. The above actions, in addition to any adjustments that school boards make to district budgets, could help to increase the yield. Regarding timing, the General Assembly, we think, should set the yield as soon as practicably possible. Many school district budget votes happen next Tuesday, as you know, and as soon as the legislature returns to Montpelier the following week, we will have information for you about the passage rate of those budgets and how many budget votes remain to be done. And we hope that the Agency of Education at the same time would be able to conduct a data collection so that you would have updated information on education spending based on the budget votes. With the best information that is available at the time, the House could set the yield sometime in the 2 weeks following the town meeting day break. And this would send a signal to those districts with failed budgets about the direction of the yield. As always, it's possible that the Senate would adjust the yield based on updated information it receives later in the process. And I just wanted to highlight for you that this year, more than ever, school board members and superintendents are watching your meetings. They are reviewing the education fund outlooks that you are looking at. And though you may not want them to, they are basing some decisions on that information, even though it's preliminary information. I'll move on now to the second area, which is long-term reforms starting in fiscal year 26 that need to be passed this year. And at the top of our list is healthcare costs. Discussion around teacher healthcare costs and the dramatic increases over the last few years has typically been framed by the notion that this is a systemic healthcare issue. And until that problem is solved, there's nothing we can do about these rising healthcare costs. And we don't think that sentiment is entirely correct. There are aspects of the bargaining framework that were put in place that have contributed year over year to the year over year double-digit growth. And those are things that you can absolutely change in legislation this session. And they actually would need to change this session in order to affect future years because the bargaining process begins again in April. So just about a month from now, they start the bargaining process again. Approximately 80% of school district budgets are salaries and benefits. Health benefits in particular are a significant cost driver in school district budgets. The move to high deductible plans, as well as the move to statewide collective bargaining, was supposed to slow the rate of growth in the cost of these benefits. And as we all know, that did not happen. The current level of HRA funding, which was determined through the statewide bargaining process, combined with the plan design, means that the health plans provided to public school employees have actuarial values of between 92% and 98%. Described another way, public school employees are responsible for between 2% and 8% of their claim costs, and the lion's share of that balance is paid for by the taxpayers. Health plans are typically categorized in the industry by metallic levels, and the VHI health plans with actuarial values over 92% are considered to be platinum plans. The statewide negotiation process is currently structured, has not been successful in slowing the rate of growth of the costs of those benefits. I provided testimony to the House Education Committee on January 4th about that existing negotiation process. So that's a good document to look at if you're trying to understand how the process works. These are some of the proposals for changes to the process. Those of you who were here in 2021 might remember that there were two competing bills for changes to the negotiations process. The VSBA supported H63 of 2021, which was not enacted. The legislature enacted H81 of 2021, which the Vermont NEA supported. The proposals below that I'm going to talk about here in a minute here are, they originated in H63 of 2021, and we think they remain as changes that are needed to the negotiations process. And I'm not going to go through each of, they're quite detailed. They're in my written testimony. I'm not going to go through each of them in exact detail, but I would like to highlight just a few of them. We think it's important to require the arbitrator to determine which of the two submissions most appropriately balances access to healthcare benefits and reasonable cost containment to ensure the financial sustainability of the plan. We also think it's very important to require the arbitrator to give weight to the actuarial value of the health benefits. And neither of those things are required currently. There's a couple other recommendations that we have under that section that I'm going to skip over in the interest of time. In addition to the suggested changes from H63, we also wanted to provide support to the ideas that were presented by the employer commissioners to the House Education Committee in January of 2024. And they talked about restructuring the bargain commission to create an engaged, broader group of stakeholders who are interested in the outcome of these negotiations and who will work together to toward sustainable, high-quality healthcare coverage and overall wellness for public school employees at a cost that is affordable to our tax-paying public. They also talked about altering the composition of the commission to include more neutral voices, especially those with experience in healthcare. The legislature has delegated the authority to the VSBA and Vermont NEA to select commissioners. The legislature could add other organizations to the process to achieve a more collaborative agreement rather than an arbitration award. The addition of neutral members to the commission creates an incentive for the employer and employee commissioners to engage in meaningful deliberations and brings additional expertise to the table. Next is allow the arbitration panel to create an award based on mixing that the panel finds based on the evidence that it receives. The current law requires that the arbitrator select either the employee's final offer or the employer's final offer. And this model, which is a winner-takes-all model, impedes both sides from proposing meaningful changes. Next, expand the commission's focus to include a collective response to the unsustainable growth in healthcare costs. Since the creation of the commission, premiums for the most popular healthcare plan, Family Gold CDHP, have increased by 110%. The consumer price index has risen by only 35% during that same time period. And this skyrocketing cost of healthcare benefits is unsustainable. I'll just give you a few numbers so you can see what I'm referring to. The total annual premium cost of the Family Gold CDHP in FY18 was $17,394. In the following years, premiums have increased at an average annual rate of 11.2%. In FY25, this same healthcare plan will cost $36,548. At the current level of growth, the Family Gold CDHP in FY30 will rise to $62,142 a year, a 257% increase in just 12 years. And FY31's premium would be just shy of $70,000. These numbers do not include HRAs and HSAs. Our last recommendation for the Healthcare Commission, or under this topic, it's not Healthcare Commission related, is to create an Education Finance Joint Oversight Board composed of legislators, administration officials, and local school officials to provide year-round ongoing oversight of the administration of the education fund dollars to ensure strong administration, management, and utilization of the fund and any federal funds managed by the Agency of Education. I'm going to stop there and hand it over to Chelsea to deliver the rest of the testimony.
I just have a quick technical question almost.
Sure.
I remember a proposal to do that Education Finance Oversight Board. Was that 2 years ago?
Yeah, when we did.
Was it part of 127?
127.
Okay,
Yeah.
and it was like there and then we took it out at some point? Okay, but we spent like a lot of time talking about it, right? Just trying to refresh my memory of, and has that been an ongoing suggestion or is that a fairly recent?
That's
Some topics in education go like, come up every 3 years and it's sort of second time surfacing. Yeah.
I think it is second time surfacing, but I'm not sure that our associations surfaced it the first time.
Okay, great. Okay, thank you.
Do you want to switch real quick? The next section is long-term reforms and spending and taxation that could be passed this year or next year. We combined those two sections. The first is around mental health needs, which I think you all have heard a great deal about. The mental health needs of youth are growing. Mental health supports are critical for students to access their education. There is a decrease in the capacity of mental health organizations to keep up with the growing needs in schools. As a result, school districts have understandably responded by directly hiring limited mental health professionals when available, further exacerbating staffing levels at the designated agencies and only benefiting those school districts who are able to hire them. School administrators report the growing complexity and intensity of student needs. The ultimate goal of school districts in Vermont is inclusion. However, in some circumstances, students need alternative education placements. Currently, there are wait lists for students to get into these programs, and for students who are able to be placed in or out of state, the cost for those programs has risen. Students who are on wait lists are supported by schools to the best of their ability, frequently requiring significant resources. Some school districts are building alternative programs within their school districts to address this critical need. In some cases, ESSER funds supported programs and personnel designed to address increasing mental health needs during the pandemic. As the ESSER funds sunset, the needs of students persist. School districts had to make difficult decisions this year on whether to absorb those vital positions into their local budgets. Mental health services are just one category of wraparound services that schools provide, which impact local education spending. Some school districts provide dental clinics, medical clinics, and adult learning programs, to name a few. They provide breakfast and lunch, after-school programs, and summer learning opportunities. Schools provide so much more than education during the hours of 8 and 3. As our state's broader needs grow, schools often step in to address those needs. All of these programs, while incredibly important, have costs. To address the increasing costs associated with mental health needs and other wraparound services, we have the following recommendations. First, determine the cost of mental health services and other wraparound services in schools and assign those costs to an alternative funding mechanism. Second, examine and help to ameliorate the capacity challenges within mental health partners. Third, ensure the use of federal dollars to support mental health needs and wraparound services are taken full advantage of. For example, Medicaid in schools. Please consider supporting H630, which is being considered in House Education Committee, which is an act relating to boards of cooperative education services. It's an important policy step that can help with collaborative efforts to address alternative education placement needs. The second recommendation in this category is a statewide teacher contract. Though it hasn't been discussed at length with our association, when we issued a survey to superintendents to ask about cost containment strategies, this was one of the responses by several superintendents.
Can I ask you a question about that?
Yeah.
Given that the statewide healthcare bargaining did not.
Makes sense.
Oh, great. I'm not following along because great.
We recognize that with healthcare costs, that may not result in cost containment. However, we would be remiss not to mention it on the basis of potential equity considerations. And BSBA has not developed a position on this topic, and we have not discussed it at length at BSA. Number 3, attrition mechanisms. The VSBA has a long-standing resolution recommending the creation of a stakeholder task force to explore the advantages and disadvantages of establishing a state-funded initiative in support of early or on-time retirement. 2 conditions of a district's participation in the initiative would be a commitment to reducing total personnel through the retirement program and sustaining these savings through future budgeting processes. This has not been vetted by the BSA, but felt like it was appropriate to still include it in here. Instruction at scale. Class size and student to staff ratios are often considered in cost containment strategies, but can be both nuanced and politically controversial. And then I included the report on student to staff ratios from 2018 in that section. In her testimony to House Education yesterday, Superintendent Megan Roy said the following: "I don't think it's hyperbole to say that we're in an intractable financial challenge in education. But I think we will not move this conversation forward until and unless we ground those discussions in what is good for students." Superintendent Roy goes on to shift questions about class size and student to staff ratios from cost containment to quality instruction, highlighting the 3 primary categories: class sizes for quality instruction, expanded offerings at scale, and the need for trusted leadership and vision. And I recommend it's linked in there that you take a look at her testimony. Why do we suggest focusing on class size rather than staff to student ratios? Increasing the staff to student ratios through policy mechanisms may disproportionately impact support personnel such as mental health professionals and interventionists. We recommend looking at a minimum class size because, as Superintendent Roy states in her testimony, a look in this area shifts the focus to ensuring quality instructional experiences for students, something that can be negatively impacted by very small class sizes. We're talking single digits. It is important to note that the education quality standards currently has some language to address optimum class size. And then I go on to quote that section, which just talks about the number of students per teacher in different grades. The General Assembly could both examine how this particular section of the EQS is implemented across the state and whether additional statutory changes are needed. Superintendent Roy's testimony goes on to address very small schools, stating, very small schools make it difficult to offer the robust and quality education we know we want for Vermont students. When you don't have scale, it limits what we can provide in terms of art, music, world language, technology. This is not just true for high schools, it is true for elementary schools. If you only have 1 or 2 students interested in band or chorus, you don't have band or chorus. This is about changing the conversation about cost containment from one about reduction to one of expansion. What can we provide for students if we had scale? What can't we do now in our very small schools? The next section is around central offices. This came also from that survey that I mentioned from superintendents. The legislature contributes to significant reporting and training requirements for school districts. I received a rough copy of a list of reporting requirements from a superintendent the other day. It has not been updated since 2018, but it had 150 line items for data collection. So we're in the process of trying to update some of that reporting of what training and reporting requirements are required each year for school districts. Proposed legislation contemplated this year would add to these requirements. Central offices grow as a function of needing to meet these requirements and to the best of their ability to prevent more responsibility from being placed on building leaders and teachers. We ask that you take inventory of these requirements and determine what is most useful for the education, safety, and wellness of Vermont students. School facilities. The House Education Committee has received detailed testimony from Jill Briggs-Campbell and Bob Donahue on the condition of school facilities, the School Construction Aid Task Force report, and the recommendations of the task force. Beyond safety, the modernization of our school buildings is critical to improving high-quality learning experiences for Vermont students and attracting families to the state. Use state policy arising from the facilities condition analysis and school construction aid report to optimize investment in newer and fewer school buildings. To begin addressing the most critical needs identified in the report and to take pressure off of the school budgets, consider establishing a school facilities emergency grant fund with a minimum of $30 million allocated and with the fund taking applications beginning on July 1. Such a grant program could address immediate capital needs and provide support to school districts in a manner that doesn't create property tax implications for the education fund or transfer that burden to other school districts. Next, you heard a lot about special education costs from Nicole the other day. In 2018, the legislature passed Act 173, which changed special education funding based on studies of education funding and practice. Act 173 moved Vermont from a reimbursement model of funding special education to a census block funding model. Act 173 cited the following limitations of the former reimbursement model. 1, it's administratively costly for the state and localities. 2, it is misaligned with policy priorities, particularly with regard to the delivery of a multi-tiered system of support and positive behavioral intervention for students. 3, it creates misplaced incentives for students' identification, categorization, and placement. And 4, it discourages cost containment. And 5, it is unpredictable and lacks transparency. In addition to changing the funding model for special education, Act 173 changed the model for delivering services to struggling students based on the DMG report, which I linked as well. Implementing these best practices was to happen before or in alignment with the change in funding structure for the law to realize its intended benefits. A support mechanism with accompanying funding to the Agency of Education was meant to support the field in the implementation of these best practices. We believe this support has largely gone unmet. Rule changes were also prescribed in the law, which were meant to provide greater flexibility in spending. Many practitioners would argue that this has not happened. While Act 173 changed the funding model for public schools, private schools receiving public tuition continue to receive reimbursement for special education, which is paid through school district budgets. As stated in the report from Nicole Lee to your committee on February 27th, special education costs have gone up. A closer look at the reason for that increase, including the implementation of Act 173 for both the instructional and funding changes, is warranted. Please bear in mind that some of this increase is likely related to the information we shared regarding mental health needs. Changes to the education funding to make it more efficient and effective, and I promise we're almost done.
No, this is great. Keep on going.
Okay. We are at a critical juncture for public education in Vermont. Impactful changes to education funding to make it more efficient and effective will not happen without state level leadership. We make the following recommendations. 1, focus on shifts to the education funding system that increase transparency. 2, consider whether a property tax system is the most equitable way to fund education in the context of whether property value is an appropriate proxy for the ability to pay. And I know this committee talks a lot about that. 3, decouple the non-homestead property tax category so that more nuanced policy levers are available to the legislature. 4, the General Assembly must lead by bringing Vermont's town tuition program into compliance with the U.S. Supreme Court's ruling in the Carson v. Macon without violating the compelled support clause in Article 3 of Chapter 1 of the Vermont Constitution. 5, establish a commission on the future funding and organization of Vermont's education delivery system. We're at a pretty critical juncture right now, and it's going to take some really good thinking together to get through it. The commission should be comprised of state and local officials with a majority members selected by the VSBA, VSA, BPA, FASBO, and Vermont NEA. 6, sufficiently fund and staff the agency of education in order to provide support schools need in the most effective manner possible. 7, the General Assembly must advocate for the immediate appointment of a Secretary of Education who is experienced, competent, and pro-public education. I think we're going on about a year without a Secretary of Education. Thank you for providing us with the time to highlight ideas for FY25 and beyond. The SBA and VSA are truly committed to working with you on these important issues.
Thank you both. I will share that I recently learned that there is now a interim deputy secretary at the Agency of Education, which there was not a press release about it, so I don't know if other people knew. I was excited to learn that. It was someone else it was someone who was promoted from another spot in the agency. So there's still a capacity shortage from those movements, but I thought that was a good development. But back to the testimony, Representative Maslin, I think you had your hand up first.
Thanks. And I'm staring at this thing instead of you because otherwise it looks like the people out there watching, looks like I'm staring at outer space. But that's the nature of Zoom. You raise a number of issues, very, very good issues, a lot of them.
Yeah.
And there's a couple of things here. One, with the chair's help, we'll have to decide what's our best responsibility with regards to the multitude of things that you've raised, because there's so much to sort out, good ideas. And I will just focus on a couple of them for the sake of the discussion. You raised mental health needs, schools that we're all very, very aware of. And I'm curious to know where we start to try to unpack that. What are the drivers that we're probably anecdotally aware of most of this stuff? But then the question is, what's our ability within Ways and Means as just one of the pieces to try to work our way through that. Another one is the notion of the statewide teachers contract. That's been around for 30 years, maybe, or something to that effect. And also, statewide health insurance and stuff like that. And so these things interrelate. And my question, I guess, for the committee and for you is, how do we pick amongst the myriad of things that you've given us to work on? How do we pick the things where we can have the most impact and be effective in the time we have between now and April May, without confusing one with another, to use plain English. So I mean, that's a committee, it's a discussion for, what you can help us with, and also, but it's the committee has to decide what's our jurisdiction and where can we apply our abilities within ways and means so that we're helping rather than further muddying the waters. Thank you. And I don't know, it's, we'll have to sort this out.
We will have to sort this out. Yeah, Representative Brannigan.
Well, along those same lines, I did at one time serve on a school board, 10 years. I first got elected in, yeah, well, it was great. 1991 is the year I got on. I was a young mother, my children were early in primary school. But at that time, because the healthcare for teachers was a big topic of discussion, and I know it's changed since then. The carrier has changed, I think. I mean, the company that provides those services. Can you, in about a paragraph, tell me where we're at right now? Who do we buy health insurance from, and how does it work? And is it a negotiable issue, or do teachers just buy what they want?
It's provided through the Vermont Education Health Initiative, which is everyone shortens to VHI. And the benefits themselves are since 2018, the law changed so that they're collectively bargained on a statewide basis. So it's not each individual school board that is bargaining health insurance benefits any longer like it would have been back when you were a school board member. It's happening on a statewide basis. And there have been 2 rounds of bargaining since then, and both have gone all the way to arbitration. And in both cases, the arbitrator chose the employee's final offer.
And is this VHI part of state government? Or are they a business?
They are, they're regulated by the Department of Financial Regulation, and they provide the plans through Vermont Blue Cross Blue Shield. VSBA does appoint people to their board. There's 3 representatives that VSBA appoints, and there are 3 representatives appointed by the Vermont NEA.
Sounds like.
And I could have, if you're interested in learning more about VHI, I could ask some other witnesses to come in and talk to you in more detail about VHI.
Maybe as it gets further in the session, and we do have a quiet time just before the frantic end, but I'll pressure the chief here, the chair, to maybe spend a day learning about that. But I want you to know I agree with Representative Maslin that I think healthcare is not our bailiwick. We just raise the money to pay for that.
Right. We did struggle with how much to include in our testimony to you, and we erred on the side of being broader rather than
That was helpful.
restricting, knowing that there are some things that aren't necessarily within your jurisdiction, but you might want to understand them at least.
There's a few areas of your testimony, and I see you, Representative Andrews, and you, Representative Anthony. There are a few areas of your testimony where essentially you suggested moving money out of the education fund somewhere else. So, strengthening mental health services and funding that sort of outside of schools, or the $30 million grant fund for school construction. How do you suggest we pay for those?
We do not have specific suggestions on that. We could certainly come back to you with some ideas.
I think it's partially also recognizing all of these additional costs that were not necessarily as present several decades ago, and that some of that all encompassing school communities that are at the heart of our larger communities are taking on a lot of non-educational expenses. And so if we are going to continue to do that that does explain some of the rising costs. And if it's an important policy decision of whether it should come from the education fund or from another source, but we don't necessarily have a recommendation. I think, the legislature has tried to study the issue before, and maybe we bring it back around this time.
Thank you. And I do think it's, we've taken on those costs somewhat by accident. And we need to have the policy discussion about, is this actually maybe it is even the most effective way of delivering those services to kids and families? We don't know, but we need to have that conversation more strategically. Representative Andrews and then
Do
Anthony.
you mind if I quickly add to that?
Oh, yeah, please go.
And if you talk to superintendents about this issue, they'll say that they don't want to be pulling mental health professionals to their schools, but they have no choice. And what we're doing is we're decentralizing and spreading out very thin resources to individual school districts. And so they would, if you spoke to them, heavily advocate for more regional approaches to mental health services, particularly those of the most acute need, which can be costly, but it's also just beneficial for the kids and for communities to have those services regionally and not siloed into different districts where education professionals are not trained to be mental health professionals. They do a great job taking on that responsibility, but we really do need the professionals that went to a lot of schooling to be taking on some of those challenges.
Thank you. Representative Andrews and then Anthony.
I just want to start off by saying I am really impressed and grateful that you did such a good job of giving high-level testimony with some real details underneath. You wrote that line really well, and I learned a lot from your testimony, so thank you. The thing that I'm thinking about right now is the bargaining commission and your recommendations on that. I totally appreciate and would support what you have outlined here. And what I'm wondering about is, can you tell me, like, how is that commission led? Like, is there like a board chair, for lack of a better term, and how is that staffed? Do you have more detail on that?
I should probably be clear that this is mostly within the wheelhouse of the School Boards Association, that the Superintendent's Association didn't necessarily specifically sign on to these recommendations, but have an interest in containing healthcare costs.
And I can answer your question about, so there are 5 commissioners on the employer side and 2 alternates. And on the employee side, same thing, 5 commissioners and 2 alternates, and each side has a chair. So there's not one chair of the whole commission, each side has a chair. And the way that they don't have staff that is supported by state funds. Their staff is paid for. They don't have full-time staff, first of all, and whatever help they get is paid for by each side. So the SBA and Vermont NEA.
And I guess
Yeah.
what I was thinking about is I totally value and appreciate and agree with your idea that this kind of looks like a showdown from the get-go and is not the most helpful framing. But I'm just wondering out loud if it would be valuable to have the person or people who lead this organization be like trained facilitators or negotiators versus like 2 people who are in an adversarial position.
That's certainly a possibility. I know that the commission itself has worked with facilitators in the past as the first step in their bargaining process.
And then I also just wanted to say, like, the reporting requirements comment was eye-opening for me and feels like a relatively simple way for us to impact change.
We currently have we hired a lawyer to help us look into the statutory requirements for training at the recommendation of our members, and we should have that soon-ish. It's taking a long time, so that is evidence of what we're talking about.
Do you have specific, I really appreciated the way you framed class sizes as sufficient class sizes are really a path to opportunity
Yeah.
and sufficiency in a school and being part of the education quality standards. Do you have specific policy tools that you would recommend to actually bring us towards that?
In the recommendations that came from the superintendent survey we issued, some people mentioned the class size policy. I think it would take significant testimony to just hear about that piece on instruction and what it means for instruction. But that's as much detail as I can give is like a class size policy.
Representative Anthony?
Thank you very much. I appreciate it. And I did listen to the Thursday morning Ed Committee testimony and questions. I want to step back a little bit and go to a couple of your subject matter issues framed as a question about the desire on your part for the legislature to be prescriptive and dig into the details as opposed to delegating. And I say that because it comes up in your reporting discussion, your healthcare and bargaining discussion, the not only package of healthcare reimbursement model, but whether we would be, as the federal government does, saying to Blue Cross Blue Shield, by the way, if you want to provide healthcare, here's the tiers of reimbursement rates for appendicitis and this and this and this. And as Doug Hopper has said, charges for healthcare procedures in hospitals are all over the place. $3,000 here, $1,000 here. So, but the overall question is, what are you urging us to do at level of detail? And I say that because the reporting requirements probably come from rule. They don't come from statute. Never mind the jurisdictional issue of what Ways and Means is supposed to be involved in. And I go back to a debate that I bet you participated in when we had a education commissioner called Rick Mills, who said, be careful what you wish for when you create an agency of education in the executive branch. And I guess I have to ask the question, is that model working?
No.
And I have to ask that because here we are at a juncture where everybody's saying, let's reinvent, if you will, the relationship between the legislature, the executive branch, and the local delivery of education. Okay, well, for 100 years, we didn't have an agency. We had a board and a commissioner. But then the legislature had to dig into weeds that we now don't do. We delegated to the agency, which is not providing the goods. So I'm a little worried, being a legislator, of whether I would want to wade into the benefit package and say prescriptively, by the way, Blue Cross, here's what you're going to offer. And at what price, as Medicare does, for instance, for us oldsters. I'm not sure. You be careful what you wish for, I guess is one way to say it. So I have to frame it in the larger question terms before I get down to whether reporting requirements are overly intrusive or not, or useful or not. So that's where I am. I want to know whether we've got the right model. I know the immediate questions that we have to answer and the FY25 issues that we have to solve, but I'm honing in on the ones that are intermediate and long term.
Do you have responses you want to share on that?
Well, as far as the specific cost for appendicitis or whatever, I don't think that we're getting into that level of detail here. And certainly if that was something that you wanted to explore further, I don't think that we would be the right witness. I think people from BHI would be the right witnesses.
That was Hopper's suggestion, to save $20 million for what it's worth.
Can I speak to the commissioner?
Yeah, please.
We are advocating for bills that look at the composition of the State Board of Education, as well as a shift back from a secretary to a commissioner model, and are in support of those bills.
You mentioned that you would like us to increase transparency in whatever we do for funding. What does that mean?
I think that comes from reports and frustrations from the superintendents, particularly this year, and I imagine school boards as well, of just being unable to explain all of the factors of the education funding system to their communities. So even if that doesn't happen this year, I think it is a significant area of concern that the public wants to know what's happening, and it's a very hard thing to explain.
And that's something that we say over and over again, and I totally understand it because I've been trying to explain it publicly on the regular lately, and I understand, it's hard to do it in a way that's meaningful and uses regular words. It's interesting though, we don't expect that of our income tax system. I recently bought a car and the car dealership didn't know what sales and use tax was, but I paid it anyway. I paid it anyway and they accepted it anyway. And so I think it's an interesting question about why and I'm not saying, and I agree, it would be great if it was simpler. I think I want to go a step deeper into saying, why do we want transparency? And what do we gain from that? And what do we lose from that?
Yeah, and I think it's also about like we talked a little bit about like when the yield is set and like that things are fluctuating for several months into the process. And so building a budget is a very challenging thing when the yield is shifting and things like that. So beyond just how the public perceives the complexity of the education funding system, the deadlines and the security of the data, such as like the long-term weighted average daily membership, like when that's finalized is a challenge for school districts.
So there's I just want to sort of make sure I'm understanding what you're saying. There's two pieces. There's the piece of need current meaningful information in order to set a budget.
Yes.
Absolutely makes sense to me. And then how districts are able to communicate with the public about what's happening, which is also really important and meaningful. And sort of those are in some ways separate issues. Is that what you're saying?
I would agree.
Okay, thank you. Representative Demmer?
Thank you both, Chelsea and Sue, for your detailed testimony. It's really helped to sift a bunch of information into my understanding of a lot of these issues. Just want to go back to the mental health piece and wanted to get more of an understanding of how districts interact with designated agencies and who picks up the tab. Is there a model for that, or is it different all over the state? Give me some examples. That'd be helpful.
The degree to which school districts interact with the designated agencies is very variable around the state, depending on capacity of those regional mental health centers. So in response to whether the capacity in those particular regions, it's very different. Like I had mentioned, some are building their own in-house programs, and that's all funded within the local school district budget. And then for those that do interact with the designated agencies, they contract those services. So you're either hiring school-based mental health clinicians in your school district, or you're contracting out those services. And some of the benefits of the designated agency is that there's professional, like you can have like a kind of a community of practice with professional learning, and that they're trained in a facility that is equipped to keep up to date with the most relevant training information and have other peers to connect with in terms of solving the needs of students.
So in all cases, are the schools picking up those costs? Those costs aren't being borne by DAs or DMH. It's being paid through the ed fund.
I don't want to globally say that, but I would say I think the majority of the costs are borne by the education systems themselves. I can't speak to like no dollars, but can you, I don't know, I think you're right. Yeah. They could have grant funding, for example, that is allowing them to be in these schools.
Okay. Thank you.
I'm just gonna ask a question in between everyone else's questions because that's my prerogative. Very exciting today in particular. The designated agencies, and like sort of the question of districts having contracted services versus services in-house. I know in my district, at least, staff have been hired away from the designated agencies, paid a higher salary. The school then is able to get sort of more on-demand services. But we do lose that sort of systemic piece, which is very, very helpful. And like the access to psychiatry and all of that community practice stuff you described. the General Assembly has actually put significant money into the designated agencies over the last couple of years. I know they're still underfunded. But I'm curious, what policy tools do you think that we have at our disposal in order to make sure that school districts are contracting with designated agencies in a meaningful way? I know that when I talk to school personnel or superintendents, it seems like there's a real disconnect in the contracting process. And I know that our healthcare committee has taken some testimony on this with the education committee, but beyond sort of sending more money to the designated agencies and saying, do a better job at this, I'm like, what policy tools do you think make sense to add sort of in the context of the education fund for us to be solving this problem?
Yeah, other than the support of the BOCES bill, I'd have to go back to my membership and ask that question more specifically, which I'm happy to do.
Thank you. 1 second, Peter. Representative Bodie?
Well, you asked that question, what levers do we have? What if we said that unless you maximize pulling down all federal funding, because I understand there's still $17 million worth of federal funding that isn't being pulled down because of how mental health services are being provided in some instances, and I can't remember what it is. If it's in the school, you don't pull down the federal funding, or if it's in the designated agencies, you don't put down the federal funding. I'm not sure which, but anyway, any case, if you couldn't add to your school spending to be reimbursed by the education fund expenses that have to do with mental health that aren't the most cost effective, that would encourage you to do it in the most cost effective way, or in a way that we wanted it to be done in the legislature. Not that that should happen, but I'm just trying to figure out a way to say, I'm just throwing that idea out there.
It'd be useful to ask the Medicaid office to come in and talk about like kind of the relationship with schools and that funding, and whether it's being taken full advantage of, and where potential sticking points might be.
Thank you. Representative Anthony? And then
I think you could shed the most informed light on the central question that I don't think you addressed, which is to say, however we figure out how to bill Medicaid or support the regional mental health services, the question which you would help me answer is, are those services best delivered by removing the child from the school and over to a clinic at Central Vermont Mental Health, or deliver them in the school with the child in the school, however the professionals are paid and agreed and contracted with? That's the key thing. Is the student to remain in school or not? And we can figure out who pays the check and whether the professional is properly certified.
I guess I would say that we, in this room, we can think about who pays the check, and in other rooms, they can decide where the
I
services.
perfectly agree, but that's the obvious missing answer, is where do you deliver to the student, in school or out?
Representative Beck?
As far as healthcare, HRA is a use it or lose it proposition. We could just go do HSA.
Yes.
Yeah.
Discontinue or just
We could just move to HSA instead of HRA, and then you get rid of the use it or lose it mentality with those dollars. And then, but the bigger picture, I heard little bits and pieces here, but I think the bottom line is, I think everybody knows it, is that our staffing ratio is about 4 to 1 in the state. And if we were 5 to 1, we'd have piles of money, and we'd still be an outlier. That's where the money, 85% of our money is spent on people in the building. And we're at 4 to 1. And so as you think about strategies, and I think that's where you need to be looking at it. What's the what's the accumulation of all of this and how are we gonna get to 5 to 1? So that we can actually afford things like school construction or other types of programs that schools really need.
Yeah, we don't disagree with anything that you said, and I would like to let you know that the employer commissioners really pushed for the HSA option in the
Good.
bargaining.
Yeah, I'll just say that our members just asked that we try to frame it within the context of instruction. And the staff to student ratios might is not the favorable way from our members to discuss personnel costs more related to class size and opportunities related to class size.
Are there specific, so moving to sort of minimum class sizes or ideal class sizes, making sure that we have buildings that are newer and fewer, making sure that, sorry. And like, we need to be, if we're gonna get through this, we need to be able to put like really hard ideas on the table and work through them, right? If we're, so those are sort of two, but there's like an endless, there's a sort of an endless list of similar proposals to that that are not going to be appetizing at the district level, at the school board level, because of like, that's just closer to people and people's like, long-term feelings about their school, or the fact that like, in a small town, everyone knows each other or whatever it is. And, districts are making really rational decisions in their district's interest, as is their purview and their job. What I haven't yet heard today are like sort of levers that you think would actually help motivate districts to be making those kinds of decisions. What are the carrots or the sticks? And I can't believe I'm like, that's really the most ridiculous expression in the world, and we like use it all the time. It's just like a terribly mixed metaphor. That seems the crux of all of this. And, like some of us would say that like the really only carrot and stick we have is the yield number and, sort of where we set that and how sensitive it is. So I don't know if you have an answer to that today, but that's sort of for me, a lot of what all of this, we can nibble around the edges and make space for that to be more sensitive. But how do we motivate that kind of change at the district level with the tools we have at the state level?
One thought, but I have one thought too. I wonder if it might be the same, but
I think the school facilities needs is a really
Yes.
important opportunity, and the House Education Committee has heard extensive testimony from states like Rhode Island, for example, and Massachusetts, that have really used the need for modernization of school facilities to incentivize, don't like to use this word on camera, but consolidation. The way that they have done it has really created these really nice opportunities for modernization at the same time. So it's a little bit of that carrot mentality, to use your expression.
Did you want to say the exact same thing, Sue? Okay, great. Okay, so it's Representative Matos and then Sims and then Maslin, but I might jump in between there.
Well, thank you. Now that Brett Beck went, Madam Chair, kind of stole my thunder a little bit.
Sorry for your
I was gonna
thunder.
say, but I caught the beginning of your testimony on my way in, and I heard some mechanisms for some cost containment, which is great. But I'm hearing an awful lot about, shifting money out of the ed fund or changing levers just to either decrease the burden on the education fund, which just gets shifted to another hand, or changing levers that again just kind of shifts it from maybe a homeowner to a rental apartment owner. And I think some testimony I heard from AOE earlier this week, just to come back to, you can call it classroom size or teacher ratios. I think at the end of the day, you get the same number, it's just a different kind of name. But when we see a 0.5% decrease in the student population, and a 2% increase in teacher FTEs, there's a bit of a disconnect there that these classroom sizes might be getting smaller based on the numbers. And then also with the ESSER funds going away, which help fund temporary positions, I did the math and there was about 450 FTEs that were pertained to ESSER. Well, about 450 stayed in the budgets after, so those one-time funds are, and school budgets are picking up the difference, which I think there's probably some ESSER funds that were used on already permanent positions that were just shifted to the funding. But what I'm trying to get at is we really have to look, and this is where Brett Beck and Jared Kornheiser stole my thunder. Really looking at the nuts and bolts about classroom sizes, because 80% of your budget is the people in the building. And I would love nothing more than to be able to organically create a way to fund school construction, because we do have a lot of aging buildings in the state. But relying on increasing taxes to be able to do that is just kind of a non-starter for already struggling for honors. So I'm looking forward to hearing more about how we can get to an endpoint with some cost containment and reconfiguring schools on how we do instruction.
Representative Sims?
Certainly, everything that other folks are saying around the table really resonates along with your testimony. I'm curious about a couple of things as we talk about newer and fewer. I guess I'm curious whether you all have positions around carrots for consolidation being around all classes, or whether there's a rationale to differentiate incentives for consolidation for elementary schools versus middle and high school. They're thinking about what's appropriate for how long kindergartners should be on buses.
Yeah, we distinguished this in our testimony to House Ed a little bit. The facilities models in other states typically have pointed to middle and high school in that area. So that's part of it. And so what we did is we recommended, based on research, the size of secondary education to provide opportunities has been studied. And so we made recommendations, I'd have to pull it up based on the number, around middle and upper grades. But then we also included, based on stories from superintendents, that we could also look at within district elementary configuration, where, you know, there are still some districts that operate elementary schools relatively close to one another. Like, for example, there's a district in the southern part of Vermont, which I'm sure you all have, or maybe some of you have heard some of this, had to close because of staffing issues. And so we did specify that looking at within district models of elementary school can help to accommodate some of those concerns about the traveling long distances. So yeah, we focus more on middle and upper school when it came to the construction piece of it.
And then I think there are options in at the elementary level, because definitely there is a lot of research around smaller class sizes in elementary being really appropriate. I think then there's the opportunity when you think about school construction around early childhood co-location or community schools co-location and that kind of thing. And that's where the efficiencies can come in that, but still needing to be strategic.
Yeah, I really appreciate that level of nuance as we're thinking about consolidation, that it may apply differently around how close facilities are to each other, especially across the different grades. I just got two other pieces that I'm curious. I think this is just another version of what you were asking, but here you're all saying that there's support for conversation around class sizes. Curious to hear any more thoughts about what role you might see the legislature playing in incentivizing sort of minimum expectations about class sizes, or whether you think that that's a decision best made at the school district level.
I don't have a concrete recommendation, but will point to the fact that it's there's specifications already in rules, and how is that being implemented, and does it merit looking at it from a statutory level rather than a rule level? That's really all I have today, but I can look further into it.
So wading into the tough conversations.
And I think the fact that it is contained in the EQS, and when we were working on Act 127, we put a huge emphasis on how important the education quality standards were to having Act 127 work well, and how much that has sort of fallen off the conversation over the last little bit. Oh, yes, you can have one more and then I have one. Yeah.
You know, appreciate colleague Beck's, focus on a class size. I guess and you can say that you all have no opinion on this, but I'm curious whether you have any thoughts about how the challenges that we're facing, raising the funds necessary to support education, intersect with the housing crisis that we're facing, and certainly maybe if there was a reduction in staff to student ratio, we might have all the money that we need to fix our buildings, whether growth in grand list is also another way to help raise funds that we need to support schools. And if we met the 40,000 new unit targets that folks have said Vermont needs to accommodate the pressures we face around housing, whether that, we would also be raising more revenue through property taxes if we had 40,000 new units, and kind of the intersection between investments in housing and our ability to fund like education for all.
Yeah. It's all interconnected, but I don't have anything.
Yeah, it probably would depend on the kind of housing, and there's a lot of details that would need to be ironed out, I think. But you raise that they are all interconnected.
You mentioned some recommendations related to early retirements, or retirements in general, and I'm curious how you think that actually plays out mathematically. We have had some sort of brief conversations about, given the teacher shortage, retirements could actually cause an increase in salary needs as new teachers are hired, with sort of a different bargaining situation in front of you. And then also we are, still responsible for the pensions here. And so how that plays out with the pensions. And so your thoughts on how to structure that as cost savings, given all of those other pieces.
I think this was based on a long-standing resolution that VSBA has had. And of course, it was developed at a time that's not, now. I think it was the reason that it was developed was looking at the salary levels of a teacher that's near retirement versus a teacher that's coming into the system. And I think that's the basis for that. But how it would interact with today's current economic conditions, I think would be something that would need to be looked at by probably an economist.
Thank you. We're going to need to wrap up and move on to Jeff's testimony. So Scott, and then Jim, and then Peter, but really guys, quick.
My comment has led to a class size conversation. And I wasn't actually thinking class size. I think our number of teachers and our class size in Vermont is much closer to where it should be than we think it is. I think it's all of the other additional employees that have been piled on. I have a school where 200 employees and there's probably no more than 50 classroom teachers. So.
Yeah, we can look at those numbers statewide because I don't have it. Representative Maslin?
Yeah, thank you, Madam Chair. You asked the question about what policy tools, which is really relevant, but I'd like to back up to your request for more transparency, which I think relates very closely to the amount of complexity we have built into the system at all kinds of levels. And to skip some short paragraphs and get to my point, I think that the complexity lends itself to the situation where we frequently have A versus option B, and we well in our conversation about those things when neither one is really appropriate. Neither one solves the problem. It just solves the question on the table at that moment. And so this is an excellent conversation, but I wonder what the outcome will be, because I don't think we're getting much closer to providing mutual assistance around the table than we were when we started, although we learned a lot. You know, we shared a lot of stuff. I just thought of that as, and the question is, how do we reduce the complexity, which has a lot to do with our education funding formula and distribution of funds formulas, so that we actually can work on the questions that we mutually agree that we need to solve.
And we don't want to fuss too much with equity as well, because a lot of the complexity is based on the question of equity, which we stand behind. So understood that it's very intertwined and complex.
Thank you. Representative Anthony, and please be brief.
Thank you. Back to classroom strategies, and size, try to work up from that. Once upon a time, it was okay, not only okay, but beneficial to have multi-age, multi-grade, single classrooms. I don't know if that's still on the table in the ed world, is it?
Yes, if it's a concerted.
At the elementary level.
Well, and if it, Megan Roy, whose testimony I linked, really talks about this, so I won't go into too much detail if you want to take a look at that. But she talks about multi-level grades for necessity are sometimes not the same on an instructional level as multi-grade levels for the quality of instruction. So multi-age by necessity might not necessarily equate to the same instructional benefits that multi-age in schools with scale might provide.
Got it. I mean, the small school issue revolves around resolving what can you put in a classroom and feel like you're delivering opportunity and equity to the participants.
Representative Andrews, you have your last word.
I would just wanted to let you know, Peter, that our school in Westford is multi-age and very successfully so.
That was my experience, but again, I haven't been in that world for 30 years, so.
Yeah, I highly recommend looking at that testimony. It's extremely nuanced and for the time that we have today, but noted it, and that was mentioned for sure.
Thank you. And Megan Roy, I think gives great testimony.
Yes, she does.
on the regular.
Yes.
Thank you very much.
I had her with me.
And this is, of course, not even close to the end of the conversation. It's just a nice stop to sort of help us recenter ourselves in our work. Thank you.
Thank you for having us.
Thank you. We're happy to come back again.
Yes, please do. Jeff, would you like to join us? Thank you.
I feel like I've been joining you, I just haven't spoken.
Would you like to come sit in the chair and tell us things that you think?
Sure.
Thank you.
No,
Or you don't have a companion?
oh, he's otherwise occupied. Good morning. For the record, I know most of you, but not everybody. I'm Jeff Bannon, Executive Director of Vermont NEA. It's the first time in this committee in a while, so
Glad to have you.
yeah, it's nice to be here.
Colin is usually sitting here.
Yeah, Colin,
all day, every day.
whatever various reasons, we divvy things up and he's here more than I am. So it's good to see everybody. It's good. I'll be a bit more conversational to start. I don't have written comments. I have typed up comments
Mhm.
and it's chicken scratch all over them based on your conversations just a few minutes ago. So I'm thrilled that you're grounded and I'm going to make sure that we keep grounded in what's best for students. That's what we're all about. And I know we're all there. It's a gentle reminder to us all that we get caught up in financing and money and taxes and budgets. And at the end of the day, what we're trying to do is educate Vermont's children. And that's really, really important. And also we've got schools that are, we want to make sure that staff working to educate these kids are in schools that are not held together with duct tape and baling twine and hope, that they're not filled with poison, that they're a nice environment to educate kids, and also a 21st century environment in which to educate kids. Kids are different. Our environment is very different. And we want to make sure that they have the environment that they deserve. So laying that as a foundational start, I'll try to answer some of the questions I really did appreciate Madam Chair, the email yesterday with outlining where you want this to go. I'll try to do my best. If I miss, I apologize. That's on me, not you. So thank you. I'll start with FY25, new revenue. And we met a month ago. It felt like a Friday night. It was dark. When we went into the meeting, it was dark when we came out, but of course that's January in Vermont. But we think it is wise to look at new revenues into the Ed Fund and support the current conversation about the addition of a cloud tax. Let's just put it out there. I think it's a great idea. It's, again, as we want our schools to be 21st century, want our taxes to be 21st century. This is a tax on products, if you will. And you know this better than I do, that we're always taxed and are not being taxed now. For example, when I had a computer and bought it in the 90s, we went down to Staples or someplace and purchased a CD-ROM or a 5-inch floppy or whatever it was, and we paid a tax to install Microsoft on that computer. And now we just grab it from the cloud. And so it's a tax. It's just an evolution and updating our, it's a straightforward alignment of tax policy with the evolving commerce of the state and the country. So that's one idea. Income sensitivity. We believe progressivity, if I could say that right, is an important value in our education funding system. And we think it wise to make adjustments to the income sensitivity to help address the increases. This will support middle and working class Vermonters, many of whom are educators, teachers, for example, further protect working people. And we also believe that given the rise of the CLA as a direct reflection of home values, that is worth looking at current home site values applied to the property tax credit. Fair share for high income folks. We also believe that income sensitivity.
Can I ask a
Sure.
to back up once? When you said the income adjustment, what did you mean by like adjusting the income adjustment? Did you have something specific about that?
Home values are ever escalating right now at a very rapid pace. And we probably should be looking at who qualifies for income sensitivity.
Okay, thanks.
I think that's
Okay.
in the context of that ever expanding environment of home values. And making sure that we tax people on their ability to pay at a better rate, say it that way. Likewise, income sensitivity for middle and working class people should ensure that that means with people with the most means, high income earners, are paying their fair share. So that's equally true, we think. S52 of 2019, I think Colin may have mentioned this previously, proposed that Vermonters above a certain high income pay the greater of either their homestead property tax or their income rate. This is the opposite of the lesser construct for middle and working class people who are currently income sensitized. So the wealthy Vermonters would pay the greater of either their homestead property tax or their income that way. Non-homestead rate. We think the direction you're headed in exploring the not having the homestead rate and non-homestead rate increase of the same percentage is wise. The non-homestead rate should be higher than the homestead rate. Personally, that's a good idea. Additionally, we share your concern for renters. And as there should be a mechanism for targeted support for renters by adjusting the renter rebate in a way that aligns policy-wise with the property tax credit adjustments contemplated. Believe that. We know there are technical challenges with having a multi-homeowner rate in 2025 or in FY25. But as part of your FY25 discussions, we think you should advance practical steps now to tax second homes at a different and higher rate to ensure that the change can be stood up in FY26 or at the earliest possible moment. to make some incremental steps if you need to now to take the non-residential rate and address it differently to multi-homeowners.
For the record, we did that, and this is not for you, it's for the general record.
Yeah.
We did that with the passing of H 480 last year. That was
H what?
H 480. That was sort of the first incremental step on that. And we are waiting for the results next year. Okay, sorry, back to you.
I'm trying to push you ahead.
I love you pushing us ahead.
Yeah.
I just want that word to
That's
be
fair.
read. Yes.
Yep, absolutely. I think you talked about this with Sue and Chelsea, but segregate costs and study them. School construction, we know the need. My members are working in these schools that are leaking in some places, gyms that are closed off to students and staff because they're not safe. And we know that state has a role to play. We think you should segregate out in the education fund, and perhaps if policy and timelines align, an increased property tax rate on second homes could be dedicated to this. Likewise, student social services or mental health needs. Nicole Lee spoke here and then in Senate Finance this week. She outlined for you the shift from the general fund to the ed fund. I think she quantified it in her documents as about $50 million. I did a quick, literally back of the envelope on the counter in our home. I calculated a bit more. It's in one of her footnotes, and I don't have her presentation in front of me now.
Can you explain a little bit more what you mean?
Sure. Mental health services that previously were part of the general fund are now being discussed. They're now part of the education fund. And she quantified it, I think it was 648 positions. And there was a footnote or a notation of some kind that it was about $50 million. That's a tax shift from the general fund to the education fund that's occurred of late. And I think she said from 2021. So that's the administration's number of $50 million shifting. And that ought to be at least segregated and looked at. You talked about it a little bit with Chelsea and Sue. Schools may be the best place to serve these kids, and that may be right. I think it's Representative Anthony, you spoke about that. But should we go back to a system of transferring from the general fund to the education fund to cover that cost that was previously in the general fund? So segregate it, identify it, and then transfer it from the general fund.
Which expense are you talking about here?
Mental health, social services.
Okay.
So for example, Libby Bowensteel's in Montpelier, Roxbury, right here. She said that since 2021, she'd hired additional staff of 12 mental health folks that she had not previously had on staff. And it had doubled her expense in that arena. She also said it's the right thing to do. It's the right place to serve these kids. But make no mistake, that was a cost of the property tax that was not there before.
Do you have a policy tool we could use to segregate that cost?
Well,
I mean, yeah.
the answer is no, I'm not a business manager or business officer, as ASBO goes by now. I think they would be good ones to ask how to do that. I think it could be done. I think they know how to do it. There's been discussion of it over many years. They may be doing it already. I don't know. And I think that's maybe how Nicole got to her number.
Thanks. Oh, and you're not saying, I guess I see segregating the cost for the purposes of understanding what the total cost is for just accounting is separate from segregating the cost and saying it can only be spent in this way. So I think that's
It's understanding and then, perhaps identifying a general fund transfer to it for that
okay,
purpose.
that makes sense. Thank you.
Access to reimbursement as well. The reason you
Access.
to segregate it is for access to reimbursement as well for other financing mechanisms like Medicaid.
Correct. I think, and I'll leave it to the.
No, I understand. This is a bureaucratic issue,
Yes.
not a delivery issue.
Correct.
Representative Baktu, still in it?
Yeah. Have you considered just prohibiting school districts from hiring these positions and calving off the money from the ed fund and getting it to the regional DAs and telling them, this is your job?
No, in answer to your direct question, but what I would say is the kids are coming to schools with greater needs. That's true in Vermont, it's true nationally for whatever host of reasons. And the kids are showing up in school and need supports in order to get education and also allow other kids to get educated.
But we don't have a prohibition against a regional DA providing support in the school.
No.
Yeah.
No, but you know, if they're not doing it or incapable or staffing issues or whatever they have, and kids are arriving at school and it's 8 weeks for a placement. I got a kid, you know, we heard this, I've heard members say, I've got kids in crisis and we call the designated agency, it's 16 weeks to get a placement or something like that, or see somebody. That's not workable. You got a kid in crisis, they need to see somebody then and now. So the schools have done, Libby Bonesteel did in Montpelier, hire people to address that need right then and there. And that's appropriate.
Yeah. Most school districts used to have people from the regional DA in their school, implanted in their school, dealing with stuff like on a real-time basis.
And I think they're having staffing problems as is nationally the case. I mean, likewise in schools, you're talking about staffing ratios. What we heard throughout since the pandemic and to this day, that the number of vacancies in schools is significant and large. You go to schoolspring.com, you know, you see a lot of positions available around the state and around the country. Vermont is, just read something the other day, that Vermont is the second lowest recovery rate on employment in the country. We're at about 10% reduction from what we were before the pandemic.
Total employment.
Correct. In schools. So we're the second lowest in recovery, if you will.
Maybe another way to ask that question would be, I share concerns that we have like schools, NDAs, like both trying to fill a need, but maybe a disconnect there. And so what do you have any recommendations about concrete next steps to like help address that disconnect so that it's like one system working together better to meet the need of all of the kids who showed up in our school?
I think it was Sue or Chelsea testified that schools are rightly or wrongly seen as a better place to be employed. And so I don't know that to be a fact, but I just, you know, anecdotally, I hear that. So I don't know that we should fight that perhaps. Maybe it should be better if they're employed in schools because they're working with students day in, day out, and that's their role. So maybe that is what we should be doing as a matter of best practice. What I'm suggesting is segregate it, or at least study it and segregate it and identify it as formerly a general fund obligation that's now being burdened. It's a burden, a tax obligation on the ed fund. And it may be the right policy decision to make. But what your committee talks about is how you raise the revenue and how you identify those. And I think that's a general fund expense, I would say. It's not an education, an old-fashioned education expense.
And I don't think, I'm not sure if Sue or Chelsea testified to that. I think I was the one who was saying that that's a thing that's happening, is that hiring away.
Okay, then I apologize.
But so the making that system work well is, we have other committees working on that. How to fund it is again ours. And I'm gonna, you have a lot more testimony that you.
I don't know about a lot. I'm happy to have a conversation.
Me too, but I want to make sure that you also have time to get what you're saying.
So we've been talking about, and I'll just continue on a little bit in this vein. 10 years, our members were in this building talking about school, mental health issues. It's gotten worse. And the designated agencies have collapsed in the state. I'm not just say that. And my members know that and know it well. So I don't know if we want to pick that up and to the point Representative Sims was making, or we're discussing about, is it better that this work happens in the school? I think it may be, just accounting for it. So anyway, we need to understand better that tax shift. That's all. That's what we're saying. To Representative Maslin's point about complexity of the system, it is complex. And I think bleeding over to a bit of transparency, I think the problem with complexity is it doesn't breed comfort and support for public schools. And that's the challenge I see. So I think we've gotten more and more complex. for good and valid reasons many, many times. And just, we think moving to a more fully income-based system and away from the residential property tax for homeowners and renters is a good way to go. Just generally, we've been advocating for that for years. I've been in this committee many times suggesting that. So beating a dead horse perhaps, but hopefully that dead horse will lift up and sail away.
This committee is unfortunately under instructions that unless they have completed reading the report on the task force on that, they're not allowed to bring up the topic.
Okay.
So, but I think probably at this point, everyone's read the report. I'm not sure. I'm not going to do an attendance check on that. Representative Meadows.
Oh, yeah, just to the point of mental health, is there any like parent outreach from schools? Because my son, I love him, I care for him. I'm not a mental health professional. I don't know if he came to me with some sort of issue. I mean, he's 1, so he's not gonna, but when he gets older.
Good luck.
Yeah. So when he gets older, is there any kind of outreach between the school and parents to help educate on how to deal with any of those sorts of issues at home or anything like that to help? Like, because I can only do so much as a parent who's not in the field.
Well, I would not undersell yourself. I mean, I think as a parent, you have the greatest influence on your child. Teachers are with kids 7 hours a day in total. Maybe you're with your child at weekends, in the evenings, in the morning. That's when a lot of, dinner conversations. And so I would not underestimate your influence on your child at all. I think it's the greatest influence, person of greatest influence on a child. And I do think that there's a great number of opportunities for students and parents to engage with their child's teacher. Parent nights. I mean, this happens a lot, but if teachers and support staff are mandatory reporters. So if they see problems, they have to call them out. And oftentimes it's a phone call. As painful it was when I was growing up, and you get a call from the parent, or from the teacher, as I often did. Not good. At least my parents were engaged in that and they understood what I was doing well, say it that way. So I think there are a lot of opportunities, a lot of engagement. I hear teachers talk about, the phone calls at home, the notes home, and they are mandatory reporters. So hopefully all those systems are in place to help your son.
Yeah.
Hopefully your son never has challenges, but it may be a reality for a lot of kids, and it is a reality for a lot of kids. So anyway, the U.S. Surgeon General issued a report last May about the negative effects of social media, and Romani's president Don Tinney's downstairs in
We are not.
Right, I know, talking about that. It's a whole different conversation. So it's ongoing.
Yeah.
And we hope that you would remain engaged in it however little you can on the House floor. I'll say it that way.
No, that's great. I'm glad to hear that. I will say, I hope my son takes after me because I didn't go home with many notes from school. So I hope he continues on that. But no, believe it. I call my mom. But I will say, I'm just really.
Saoirse's gonna zoom in right now.
But I'm just glad to say there is that connection with the teacher and the parent and, school administrators.
Is ongoing.
That's awesome. That's good.
And that takes a lot of personnel time, that communication with families, right? It's
Yeah.
incredibly important, but it does take a lot of time, which, turns into the Ed Fund.
And I would
Representative
say
Andrews.
as a more experienced parent than my colleague, sometimes the call would come from me to the teacher to say, "Hey, this is what I'm seeing at home. What are you seeing?" And it had really good collaboration there. So just.
Jeff, we are running out of time. So
Yep.
Jeff,
All right.
anything else before I let my committee jump in further?
Sure. First off, we're big supporters of Act 127. We think it has the potential and will improve outcomes for students. And again, grounding us in students and what's going on there. We also know that it only addressed local taxing capacity and did not ensure adequacy. So maybe that's something we could be looking at going forward. We think that's important. So for example, the Brookings Institution did a study recently on California's change to its weights. It too did not look at adequacy. It provided, California only provided weights for certain schools. We think it should be applied to all schools. So that's certainly interesting to look at the Brookings study on California and how they did it. I haven't fully digested that, but that's an interesting study.
Can you send us that study?
I happily will. BOCES, Stuart Chelsea mentioned it. Colin was downstairs just testifying on that. We are big supporters of the boards of cooperative education services known as BOCES. We're one of 9 states that do not have statutory language that allows for BOCES. And for those who don't know, this cooperative, as I call it, would allow school districts or SUs to coordinate services at a higher level.
Like what we call shared services
It
in
might be,
the
yes.
early childhood world.
Yes, it mostly comes up, it's come up downstairs in House Education around special ed and alternative placement programs for students, but it could be also purchase of supplies and things for all the schools at a bulk rate, you know, books, for example, or whatever. So that's something I think we are supportive of, and it's moving. Your colleagues in the education committee are moving that. So that's good. Community schools, further build out community and full service schools to better serve kids' needs where they are in school. And you could draw down, we believe there are federal funds available for this, so it'll be a drawdown. So we think that's important and good. School construction, a huge issue. The House Education is taking this up in large measure. I served on the task force. And I'll just add you for purposes of your discussion. I think there are 3 sources of funding that should go along with that. Number 1 is a new dedicated revenue, just to put it out there. Because in 2007, the state made a decision to lower taxes after the Great Recession for state aid for school construction, and we're having to pay that bill. So I think there's got to be some follow-up to that. That's necessary. So dedicated revenue. Use the state's bonding capacity. We think that's absolutely part of it. It's what Rhode Island did. It's what Massachusetts did. It's got to be in the mix. And finally, I'll add, I know we've had discussions in this building about PCBs, but many schools have sued the company that made those poisons, if you will, or those products, and quite successfully. And I think we ought to get aggressive and creative about how we litigate those cases that we have. So we have 91 schools, I believe, that have sued Monsanto. The state attorney general has done it. And I think we ought to collaborate that effort and get creative about how we pursue that. And I think that generally, so one school district in Washington State had 2 jury judgments amounts of $850 million. One school district in Washington State. That's a lot of money. And we can think about this creatively and be a bit more aggressive about it and actually put that money back into schools to make sure they're safe for kids, safe for staff, safe for parents to come in and visit, and everybody in them, and they're better supported. So I think that those 3 funding sources are important. Demographics and housing. We need to get really serious about reversing the decades-long downward trend of demographics in this state. And I mean that. Talked about it a lot. I have over my many years. We need a dedicated revenue source for housing. We need a dedicated revenue source of some kind to really get creative about demographic solutions. And then, frankly, I think it's got to be on the mix. You said something about hard conversation to have. We ought to be thinking about immigration and how we support it in the state. I don't think we're going to be able to solve our own problem. We'll say it that way nicely. We are going to have to be a state that supports immigration in some large way, and we've got to have housing. We can't just bring in a bunch of people and not have housing for them. So we've got to think about this long-term, systematically, and how do we create the environment that will support increased numbers of people coming to the state of Vermont. So, lastly, oh, sure.
No.
I'll conclude with this. Many years ago, I read, I wish I printed it out. I did not. In about 2005, before the Great Recession, a Goldman Sachs report, late at night, as you will, turn around on the internet. And it talked about, it was city focused. And there had been a recent Atlantic article about the most powerful politicians in the country were not senators, the president, wasn't, Congress people. It was mayors of cities, big cities being the most powerful politicians in the country. It was an Atlantic article. It was interesting. It was thought provoking. Was it right? I don't know. But what the Goldman Sachs report was studying was riffing off that a little bit and saying the most, and I know the House has passed this, so I may be talking to the preaching to the choir a bit, but a family leave of 2 years is what they said cities could do for family leave as the most beneficial policy decision to increase people coming to their cities. And so it was interesting, and I read it and it was intriguing. Could we do that as a state to genuinely support families coming to the state? It would be, again, be a resource intensive. I'm well aware, but we've got to get creative and think about how do we invest for the future? And that may be one way. I know the House has passed that. Thank you. We support that. So that could be one thing. Going back to the wealth tax, you spoke eloquently, Madam Chair, I think a few weeks ago on the radio about how the difference in wealth accumulation in this country has changed over the many years. And so Representative Brannigan knows my wife, my wife was a former healthcare person and now a estate planning attorney. We talk about the basis adjustment or the step up, free step up. So if you own a home or stocks or whatever asset you have and you pass it on at your death, your heirs get a free step up. That's an enormous amount of wealth that's being passed generationally without any tax. There is the estate tax. I know some people have talked about it. That's over $10 million at the federal level. But that's a missed opportunity where we're passing on wealth generationally without any understanding or appreciation for how wealth is accumulated nowadays. And we're missing that opportunity, or frankly, the obligation, I would say, to tax wealth in that way. So wealth tax, you spoke well about that, better than I just did. So thank you for that, and we support that. Anyway, inflation is real. I don't think we should gloss over it. It's real for the state. It's real for the nation. It's significant in the school setting. So I want to talk about that and just remind you that that's real. Staffing ratios discussion that you had. I testified last week in Senate Finance. There is in 2019, the report on student staff ratios, which I can share.
That's not on our list yet.
Yes, and so I'll just read.
Can you find that one for us, Rachel?
I forget where I found it.
She'll find, she's very good at that.
I can send you the link.
Thank you. It's in the testimony already.
Oh, there you go. So there are 3 recommendations. I don't know if the ones as the AOE were followed through, and I think that would be good investigative part. The task force recommended that the General Assembly not include any specific statutory thresholds or benchmarks. I'll just say it shortly. We recommended, I was on this task force, the AOE compute and report on an annual basis the staffing ratios included in the report. So I don't know if that's followed through, but there was this thing called the pandemic that got in the way. So, I mean, I'm cognizant of that, but maybe it's a gentle reminder to the AOE to do this. And finally, the third task force recommendation was to research staff and student ratios in schools with geographically proximate independent schools in SUs and SDs. And to see how their choice options went and affected student staff ratios. I do agree with Representative Beck that I think our class sizes are, it is other staff around it. It's not the classroom teacher. And that's what we found in this report, and you'll read it. So that'll be interesting. It may have changed somewhat, but not dramatically. As I said, we still have not recovered from the pandemic. We're the second lowest at 9.6. So I rounded up to 10%. But that report might be more accurate today than we might know, I think.
Thank you.
So other notes I made, but I know you want to move on. I'm happy to answer any questions.
Thank you. I would appreciate if you could follow up with more information about drawing down the federal funds for community schools. That would be helpful. Just like send us something or come back sometime.
Okay. We may have an expert coming to the state, might be a few weeks.
Great.
Who might be really skilled, far better than I am to answer that question. How to.
Great. And Colin, you'll follow up about that?
Yeah.
Okay, great, thank you.
Yep, happy to do that.
With that, thank you very much for joining us.
I also, let me just
Last one, yes, or second to last.
yeah, second to last one. VHI, I recommend having the VHI code trust administrators who explain healthcare and the cost drivers there. They've been around the building. And after your town meeting day break, you might want to have that back in. So thank you. More notes here, but meet offline as you will.
Thank you. And I don't know if we always all read all of the written testimony attached to something, but I would particularly recommend that you make sure that you update your written testimony.
Okay.
Anything you said today, because
I may expand on it, given some of the notes I made.
please feel free, but
Get to-
really, yeah, I think those are going to be, the testimony from today is going to be a real guide star as we, over the next few weeks. Thank you.
Thank you. And I look forward to engaging with you. We look forward to engaging with you in that conversation.
Thank you. We're going to take a quick break and we're back here at 11.